Newborn screening.
I want to share with other parents what their baby's experience may look like after birth. The first few hours and days of a baby's birth can come with so many emotions and new responsibilities. A better understanding of the newborn screening process is a gift that I would like to give to all expectant parents. I have a friend who works within the profession who can provide some guidance on what happens soon after birth so that expectant parents can be prepared and better understand what is happening behind the scenes in the hospital. Thank you, Marcus, for allowing me to interview you today on behalf of all of the soon-to-be parents.
Thank you for bringing light to this topic and allowing me to highlight the importance of newborn screening.
So, on behalf of expectant parents, let's get started with an overview. What tests or screening are required for a newborn baby?
Great question, Janelle. Newborn screening includes dry blood spot testing, critical congenital heart disease screening, newborn hearing screening, and a CCMV screen for children who failed the hearing screen.
Tell me more about dried blood spot testing.
In Virginia, soon after birth, a small sample of blood is taken from a baby's heel. The blood sample is then sent to the lab to test for newborn disorders, some of which may sound familiar, like sickle cell and cystic fibrosis. This screening is an important tool to help provide for the best possible outcome for babies with abnormal results.
How will I know the results from the dried blood spot test?
Another great question, Janelle. The results from the dry blood spot will be sent to the child's doctor.
I guess that speaks to the importance of expectant parents selecting a doctor for their child before birth.
Yes, exactly. And to the importance of asking the doctor about the test and if anything needs to be done.
How does the hospital test for critical congenital heart disease?
Shortly after birth, a baby has a sensor placed on his foot to measure the amount of oxygen in the blood.
That's so interesting. I never even knew that they could check my baby's heart function from their foot. What other tests will infants have at birth?
Well, all infants' hearing should be tested before leaving the hospital. This test usually happens in the room with the parent while the baby sleeps. Infants who fail the hearing screen will need to have an additional screen. This is for CCMV. The test is collected by a quick swab of the infant's mouth. The child's doctor will receive copies of the results, and the Virginia Department of Health newborn screening team will contact parents to provide information, updates, or recommendations.
This is all good information. Thank you, Marcus, for taking the time to explain the newborn screening process.
You're welcome, Janelle. Always happy to help. I advise all expectant parents looking for more information on preparing for birth to visit our website.
For more information on how to prepare for the birth of your baby, watch our other videos on the Virginia Department of Health website at vdh.virginia.gov/preparing for birth.